Hi everyone, this is Tanjariitta with Alkemia Terapia. Tonight I wanted to speak a bit more about chronic pain, the brain and the body, as well as our emotions. At the medical clinic where I have worked with chronic pain patients now for the past 7 years, it has become easier and easier over the years to notice patterns. And these days, neuroscience and the latest research really shows us why those patterns come to be. Most of the people who come to me for mental health or pain counseling because the doctor has referred them come in and say, I'm not crazy. I just want my pain medications and I want to move on. Why am I here? What could it possibly do? Or how could it possibly benefit me to talk about my pain? I already live with it 24/7. And so what we begin to talk about is how the brain has been hijacked by the experience of pain. And we start from the place of educating people about why the brain has actually learned to adapt, unfortunately, to learn to be really, really good at pain. So it's not uncommon for people who have chronic pain to have similar complaints about their day-to-day lives, such as, I used to be really organized and now I'm completely scattered. I don't remember things, even things that used to be really important to me. I used to make lists and I used to accomplish things on my list. Now I'm lucky if I even write them down, or I lose the list and I never get to them because I'm too tired and cranky and in pain. I used to love exercising and now everything hurts all the time. I am really clumsy. I break things, I drop things, I bump into things. I seem to have no concept of space. I'm scared to drive sometimes because I really feel like I'm too scattered. I have been told that I'm short-tempered, irritable, cranky. I have no patience to hear about other people's aches and pains because I really would love for them to just live in my body for 24/7 and see what it's like. Certain foods, textures, sounds, smells that used to not bother me or even I enjoyed them, now irritate me. I can't stand certain textures of clothing, or foods taste funny. Something smells funky. Bright lights, loud noises, really, really obnoxious and annoying to me. So I now avoid crowds. I can't stand to talk to too many people. I do all my grocery shopping either late at night or in the middle of the night. All of these kinds of things. My temperature, body temperature is all over the place. I used to be cold, now I'm hot, vice versa. I'm really, really sensitive to touch. So even when my loved ones want to give me a hug or my partner tries to be intimate with me, I can't stand it. My body can't handle it. These are really, really, really common complaints that I hear from chronic pain patients. And it has to do with the way that your brain adjusts to pain. The processing centers where pain is perceived in the brain, first of all, there are several of them. Some of them reside in parts of the brain where those locations already had jobs to do. It's not like those parts of the brain were just sitting there idly waiting for something to come along so they'd have a job. Those parts of the brain had the jobs of emotional regulation or logic and reasoning or creativity or regulating body temperature or other functions like that. Unfortunately, what happens is when pain comes along and the brain is starting to process acute pain, but then that signaling gets left on, those parts, the neurons in those parts of the brain begin to recruit nearby neurons to help the brain communicate to the body and to the person in that body that there is pain. And it gets better and better at it, and more neurons get busy trying to say there's pain. So where in the beginning it might have been the brain just saying like, hey, there's some pain, please take care of it. Gradually over time it becomes pain, there's pain. And it gets louder and louder, and the brain gets better and better at it. And eventually the person needs more and more pain medications, and it's not helping, and it begins to create this really vicious cycle. What is also true is that if you have had a history of anxiety in particular, but also depression, some of those processing centers for our moods are also the same as the processing center for pain. So if you have depression and now you have pain, your pain will feel worse and your depression might feel worse. It's also true, even if you haven't had depression or anxiety, that chronic pain over time can actually make you feel depressed and anxious because, again, those same processing centers deal with chronic pain or pain as do with anxiety and depression. So in pain counseling and in my work as a yoga therapist, we try to help the brain relearn that it doesn't have to yell so loudly when in fact maybe the condition itself hasn't changed. Sometimes I hear patients say, the doctor swears nothing is different about my x-ray. I had a new MRI, nothing new is showing, but I swear this pain is getting worse by the day. And it can have to do with the wiring that's happening in the body. And while the pain medications can do part of the job, or a procedure, injection, nerve ablation or something like that can do part of the job, the other part that we have control over personally is how much are we teaching our body how to calm down the signaling of the fight or flight, the pain, the stress, and how are we nurturing ourselves? How are we taking care of ourselves? How are we teaching our bodies how to soothe and calm down that alarm that is signaling us that there is pain? And you may have heard the word neuroplasticity. It is used quite often now, and it simply means that our brain is malleable and is capable of change, and we can teach it new things all the time. So some of the cooler videos that are out there now are people who are able to see with their tongue, or hear with their eyes or something like that, because of the wiring that's happening and the way that the brain is processing incoming information. What we can do to use that information in chronic pain counseling and in my work as a yoga therapist is to simply begin to train the body, the mind, the emotions, that it is okay to calm down that signaling, and there are ways to feel safe and comfortable, and to even begin to introduce pleasure back into the life. And as the nervous system, as the fight or flight signaling calms down and we are able to be more in the rest and relax and restore mode, the more the brain can kind of begin to tone down the signaling around the chronic pain. Now, this isn't work that happens overnight, and we can use many different modalities to help this process along. If you consider how long it has taken for your body to get to the point where you have chronic pain, oftentimes that means there's a history of injuries or accidents, or a lifetime of really hard physical labor, or maybe a childhood of trauma, whether neglect or abuse or anything like that, or just really a lot of chaos and stress. All those things leave an imprint. When somebody comes to me then at age 43 or 53 to work on their chronic pain, we can't expect that to shift overnight, or even in a week or 2 months. 43 years or 53 years of patterning versus a couple of sessions of any kind of therapy or modality is not going to make a significant lasting change. We have to work over time, persistently, and use skills day by day that you learn in yoga therapy or in counseling or with any of the other body-centered modalities, and then shift begins to happen. The pain medications can help along the way, but as you've noticed, there's a big movement now to move away from using opioid therapy for chronic pain. So it really behooves us to look at what other ways can we help, and how can we be in charge of our own well-being, so that If a doctor decides that we must come down on our pain medications, we aren't left to just simply be panicked and anxious and in fear over what's going to happen to us. If you would like to talk to me more or learn more about my work with chronic pain, utilizing yoga therapy and some of the other modalities that I work with, I would love to hear from you and talk with you more. So please feel free to visit my website, alkemiaterapia.com, and I'd like to hear from you. Thank you so much for listening. Bye-bye.